Let's bring in healthcare expert Seth Denson. Seth, I don't think voters really understand what's at stake here.
They really don't. All they hear is it's free, right? Healthcare is expensive. Nobody likes that, but everybody likes the idea of something being free.
Is it really free?
No, everything has to be paid for, right? So it's going to be paid for through taxes. And what Senator Sanders has proposed is a tax on employers. Well, that trickles down to hours and wages and all of that. So at the end of the day, it's the middle class that's going to pay for this.
Yeah, middle class taxes would have to go up. And in fact, Sanders has said it would cost 10% of GDP annually. That's twice what we paid for World War II. I mean, the Washington Post, Seth, Washington Post is saying to Democrats, quote, just cool it. They're saying, though, the Washington Post is saying, Seth, if you dare to point out these facts, that Sanders and the socialists suddenly get bullying, they bully you, they shout you down as, quote, morally compromised sellouts. Your reaction to the Washington Post saying this?
Well, listen, I think that they're on the right track in some ways, only because if you think about it, when you think about the Medicare system and the way it's structured, for every dollar that the Medicare system pays in, then the private pay system's paying about $2.50. And so that has to be offset. If we remove the current private pay system and move to a Medicare system, you have a sixth of the U.S. economy that's no longer sustainable. Those are jobs that are gone overnight. And all of these are details that aren't really making the Sunday morning talk shows, but they are real.
You know, Seth, in the Democrat socialist fantasy and the imagination of them, I mean, they're thinking that Medicare can be turned into a generous single-payer insurance system and a system that would, you know, basically wipe out all insurance plans. But here's the thing, Sanders, does Sanders and the socialists even realize that Medicare makes substantial use of private insurance? That's how it works. For drug coverage, and Medicare Advantage covers more than a third of Medicare beneficiaries. Do they understand that?
If they do, they're not talking about it because it doesn't make for good politics. The private pay system, again, is subsidizing it. Medicare utilizes the private pay system. While the rest of the world, which socialism loves to look at, right, all the socialists love to look at the rest of the world and say, well, they've got it. Well, they can. They have the luxury because we don't. We innovate in the United States. We develop medicine. The rest of the world doesn't. They rely on us for that.
Seth Denson of GDP Advisors. Great to see you, Seth. Come back soon.
Thanks for being back with you, Liz.
We've
Thanks.
got more in Democrat.